My name's Alex. I'm a nurse on D65 at University Hospital, which is one of the designated COVID units for patients and has been since March of this year. Working on one of the designated COVID units is meaningful to me because our patients aren't allowed to have any visitors or family, and we serve as their primary source of support during their hospital stays. And the nurses on D65, as well as nursing assistants, we collaborate with healthcare providers and ancillary staff very well, have been since the pandemic, so I'm happy to be part of a team that looks out for each other and continues to work hard and work well together.
I'm Ashley. I'm a nurse at the University of Wisconsin Hospital in Madison, and we have just started on D46 taking the COVID patients, the very sick COVID patients. I'm here every day caring for these patients, and I want everyone to know to do your part. Wear your mask, don't go in big crowds of people, and stay home if you can. With the holidays coming up, that's going to make things tough, but please just do your part so that you can help us here in the hospital as well.
My name is Becky. I'm a respiratory therapist at University of Wisconsin Hospital, and these are some of the sickest patients I've ever taken care of. One of the most rewarding things about being a respiratory therapist is seeing the end for these patients, the outcome. Sometimes that end isn't exactly as we all picture it to be, not walking out of the hospital, but maybe towards the end of life, we can be there for them in that comforting time. This work is very important to me on a very personal level. I lost my mom to COVID in June of this year. She was a spitfire of a woman. She's 75 years old, but she could run circles around anyone 20 years younger than her. She was an amazing spirit.
My name is Kaylee Greiner, and I'm a nurse at University Hospital in the Trauma and Life Support Center, the ICU where we're taking care of some of the sickest COVID patients here in the state of Wisconsin. One thing that people might not understand about taking care of COVID patients is that this is a new disease for us as well. It's never been studied before. It wasn't something that anybody understood at the beginning. It really has been uncharted territory for us as nurses. Normally, it's our job to guide patients along in what to expect and their families in what to expect. But with this disease, it's really difficult at times because we are still learning so much about it. We're still learning how to treat it. We're still learning the course that it takes. And so for us, it's been very difficult to be that support to our patients at times when we want to tell them it's going to be okay or this is normal, but we don't know that that's necessarily the answer.